Good morning. My name is Professor Enrico Agabiti Rosei. I'm professor at the University of Brescia. I am the past president of the European Society of Hypertension. On May 14 at 11:30 European time, I will give a live lecture on hypertension and in particular on controversies in hypertension. Despite many studies and research in this field, there are still some points that need to be clearly elucidated. In the meantime, also according to the guidelines that have been released by several scientific societies, and in particular from the European Society of Cardiology, European Society of Hypertension, we have given some indication on how to manage some important topics related to the management of hypertension for the daily clinical practice. In particular, I will touch the point of blood pressure measurement and especially the use of out-of-office measurements that seems more and more important in the clinical practice in order to have more information on how to treat these patients, and particularly on how their blood pressure may be controlled by antihypertensive treatment. For the evaluation, the assessment of hypertensive patients, particularly in Europe, the use of the measurement of initial subclinical damage of target organs have become a common practice. This is particularly important, not only because the presence of early cardiovascular structural alterations is an indication of increased cardiovascular risk, but also because this alteration may be regressed by antihypertensive treatment, and this regression sometimes may be related to an improved clinical prognosis. In addition, there are several points on treatment that deserve some discussion. First of all, the lifestyle approach, which is very important for every patient, for those with mild hypertension, those with more advanced disease. And among the non-pharmacological approach, certainly the reduction of sodium intake is very important. But when and how much the sodium intake should be reduced is still a matter of research. In the treatment of hypertension, in order to obtain the maximum benefit, what is very important is to establish when to start treatment and what is the target of treatment. Certainly, many patients are not well controlled. This is due to several causes, and particularly to a poor adherence to treatment, as well as to clinical inertia by the doctors. And this point deserves some discussion, as it is very important to establish what is the best way for choosing the treatment, the pharmacological treatment in hypertension, and which drugs to use in some specific subgroups of patients. And as most of these patients should have a RAS blocker in their treatment, it's also important to establish what are the advantages and disadvantages of using ACE inhibitors or angiotensin receptor blockers. Finally, particularly European guidelines, but also American guidelines have stressed the importance of combination treatment in order to obtain the target blood pressure and more cardiovascular protection. European guidelines suggest that in most of the cases, combination treatment should be given from the beginning. So these are the points that I'm going to discuss, and I'll be happy to show what is the view, particularly of European doctors, and also to answer to your questions. Thank you very much.